Hello, everyone. My name is Chris. I'm from New Anglia's U.S. office. Joining me today is our co-host, Michael, from the head of UK admissions.
Pleasure. Hello, everyone.
Nice to
From the
see
UK
you.
office.
So welcome, everyone. We're very happy to have you here and excited to share everything we're working on and a part of with New Anglia University. I want to give a special thanks to all of our speakers for joining us, our representatives from the New Anglia government, our partners from our clinical hospitals, and of course, our faculty and administrators. So it's great to have everyone, and we're excited to be with you today. Okay, so taking a look in the United States, the UK, we want to share what students can expect going out into the world and to become licensed physicians, and just how many licensed physicians are currently practicing nearly every year. So out of the entire United States, typically we see about 1 million new licensed physicians every year. So in 2025, we saw about 1 million. Now in the UK, gaining licensure, we saw about 400,000. Now out of that group, about 30% of those licensed physicians are gaining their licensure through a different route than the typical medical school brought in the United States and the UK. So what we see is that out of that 30%, a large portion, a substantial portion, are coming from the Caribbean to become licensed physicians. And so the Caribbean is great because it offers a really clear pathway to becoming a licensed physician. In the United States, we have a system called the ECFMG, which is our licensing body that works with schools in the Caribbean to allow students to become licensed physicians in the United States. And in the United Kingdom, we have the General Medical Education Council, and we have a compliance we've created with them that allows students from the Caribbean to become licensed physicians.
As far as the UK is concerned, it's
taking
exactly
a look
the
in
same
the United
structure
States and the UK,
as
we want to
the US,
share
that is. Apart from the
what
fact that
students
the
can
US
expect
MLE
going out into the
examination,
world and to
which is not
become licensed
required as we
physicians,
practice in
and
the
just
UK.
how many
Now,
licensed physicians
students
are
need
currently
to score
practicing
65%
nearly
on the
every year.
comprehensive
So out of the
basic
entire
science
United
and
States,
DME
typically we
examination
see about 1
before progressing
million
into
new
clinical
licensed
sciences.
physicians every
That's really
year.
the
So in
only difference. Now,
2025, we saw
again,
about 1
before
million. Now in
graduation,
the
UK
UK, gaining
students need to
licensure,
complete the
we saw about
clinical science
400,000.
MBA
Now out of
examination,
that
that's
group,
standard.
about
And then we guide
30%
students to
of those
register with
licensed
the
physicians
GMC
are
and then with
gaining
the
their licensure through a
UKFPO
different
before they
route than the
sit for Club
typical
1 and
medical
Club
school
2.
brought in the
After
United
this,
States and the
and after
UK.
they pass both exams,
So
student
what
can
we
then
see is that out of that
progress, with
30%,
their
a
foundation
large
year
portion, a
employment
substantial
application through
portion,
the
are coming from the
UKFPO.
Caribbean. What makes New Anglia unique? Today, I actually have Professor Lana Bokuchava to join us. So hello, Lana.
Hello, Chris. Hello, Michael. Hello, everyone.
So could you share more information about our academics, the university's mission, vision, and the diversity of our international student body?
Yeah, sure. That's a very good question. Thank you so much, Chris. From the university, it is literally the prime mission, we could say, is to shape a dynamic, research-driven community. This is quite an important thing. I'm emphasizing the idea of research because we truly believe that the MDs, the doctors, are not just clinicians, but they are also researchers from the day one. So as a result, New Anglia University is here to inspire innovation, independence, and care. Internationality, internationalization is central to the mission. So our international strategy focuses on the building active partnerships with medical schools, different universities, research institutes in the different countries, so literally worldwide. The New Anglia University provides the opportunities for students to take a part in the different exchange programs, global health projects. As a result, gaining like a first-hand experience in the different healthcare systems and set. I would emphasize here that the university also organizes and participates in different forums, different types of the conferences, and sure promote the membership in leading medical association. As a result, we can say that New Anglia University literally celebrates a vibrant mix of the cultures and backgrounds. And sure, we're quite proud to foster an inclusive, respectful environment where every student, every member of the faculty feels seen, heard, and supported. Thank you very much.
Thank you, Lana. So as far as international recognition, New Anglia is a proud member of the World Directory of Medical Schools. Now, to gain entry into the World Directory, you need to create curriculum that is designed for the World Federation of Medical Education. And so our faculty members have worked tirelessly to develop a state-of-the-art curriculum that matches these specifications. As a result, in the United States, for our United States bound students, we have our ECFMG sponsor note for the US. And so this sponsor note qualifies our graduates to obtain what's called an ECFMG certification. And that further allows them to gain full licensure to practice in the United States. Similarly, for the United Kingdom, our curriculum is GMC compliant. So our curriculum offers 6,200 hours of higher medical education, which actually over exceeds the required 5,500 hours of medical education to reach GMC compliance. For countries outside of the US and the UK, our curriculum meets the standards for Australia, Canada, which allows our students headed to either country and beyond to gain medical licensing in each of those countries. And so speaking of faculty, we currently have faculty from around the world. We have over 100 different faculty members. So speaking of our curriculum, so to develop an MD curriculum that reaches United States and UK specifications, it takes quite a bit of work and really just tireless effort on the part of our faculty members to develop such a strong curriculum. Now, the benefit of New Anglia is that we actually offer 1.5 years on campus compared to the typical 2 to 2.5 years offered by other schools. So we have 1.5 years of on-campus curriculum that's broken down into 5 terms. I would like to introduce our next guest. She's our Vice Dean of Basic Sciences for New Anglia, Professor Brandi Niemeier. Can you speak briefly about our curriculum and what that's like for our students who begin like from the start to moving into the next phase?
Of course, yeah. So our terms are unique in that, so we have 5 terms here in Anguilla that MD students will go through. That equates to about 20 months total before they will move into their clinical sciences. And the first term is, I don't want to misrepresent the curriculum. It's very rigorous, it's intense, it's fast-paced. But we as faculty are here to support the students. The benefit, though, is that the students aren't spending 4 or 5 years just in the basic sciences. And so in the first term, it's an introductory phase, but I don't want that to sound like it's an easy term by any means. But nonetheless, we cover the body systems, beginning with the brain, neuroscience, and behaviors, in addition to some biochemistry, fundamentals of medicine, and the students learn structure and function of the human body. So sort of a global, if you will, approach to understanding the human body. From there, we move into fluid regulation and nutrient assimilation. That's in term 2. Term 3, we move into the pathology, and then in the last terms 4 and 5, they really are focused on patient interactions, patient relationships, and understanding patient needs, having good bedside manner, understanding the clinical components of the practice, and really just setting them up for good clinical rotations. And also in the 5th term, we do practice testing so that students feel comfortable going in for their boards or their exams that they are preparing to take. And, you know, from my perspective, the students, they seem very happy. They seem happy with this set of coursework, but they're also happy with Anguilla. I've heard students say that, you know, in Anguilla, there are no distractions. And so that makes it reasonable that they can go through a fast-paced program that's, it's relatively intense, but they don't have the city life. Anguilla is full of beaches and beautiful people, and everyone is very kind. It's like a village. And so it allows for students to, get some mindfulness between their studies, some mindfulness practices between their studies, go to the beach and relax. And it certainly, I think, mental health wise is beneficial, but also when our brains aren't distracted by various things that happen in cities, it allows for more learning, better learning. And, I should say too that faculty and students, we all share our cell phone numbers. We call each other up if needed. The students feel very comfortable engaging with the faculty and staff here. Staff and faculty feel just fine calling a student to, for example, there's one student that is looking to buy a car, and I saw a listing for a car, and I forwarded it to her message, so to her phone via a text message. And so we all are, we're all in this together. And I see the students having very supportive relationships. They carpool together, they study together, they eat together. I've seen students helping each other on the various equipment that we're using for learning. Or in one case, one of the students helped another to get a clearer image of some tissue that we were looking at in a microscope, our microscope lab. And so they really do lean on each other. And I think that also helps prepare them for working in medicine, because certainly it takes a village of expertise to provide good patient care. And that's sort of what they are experiencing here in the learning environment. Also, I want to say our students stay involved in the Anguilla community as well. I live in Anguilla. I have children here. It's very important to me that our students give back to this island. It's not a very rich island by any means, and so healthcare certainly benefits from being supported by our students. I am currently forging a relationship with the Anguilla Red Cross for students to do training and volunteer work with the Red Cross. We are currently working on a partnership with Princess Alexandra Hospital right down the road. So our students can do some shadowing and some, skills practice and various preparatory types of work in order to support the patients in the hospital while also learning and practicing patient care in a diverse community. We're also working to make it so that our students will be able to do some of their clinical rotations, if they prefer, right here in Anguilla once they finish their basic sciences. And so it's just yet another opportunity to have an experience, and in this case, to experience tropical medicine and the various diagnoses and treatments that go along with that. And so I've been in higher education for over 20 years, I guess. There's nothing more rich than a diverse group of students, a diverse group of faculty in a diverse setting to learn in the presence of multiple perspectives, a wide array of levels of expertise and topics of expertise, and then to practice it for people who really need the services. And I think it creates a very rich learning environment. It's what I'm excited to be a part of. So all in all, as Vice Dean, it is imperative to me that students have an environment that prepares them to practice medicine anywhere. And so it's my goal to make sure we have the technology, make sure we have the community relationships and the expertise and all in all, the passion here among the faculty body to prepare students for the future of medicine worldwide.
Thank you so much for joining us. So next, I'd like to introduce Professor Puranam. So you're an associate professor of exact sciences. What would you say is your primary goal to ensure students are supported while on campus?
I would say that the way we generally try to support students is be always available, is something that's always the motto that we generally maintain in the faculty, among the faculty. So trying to see that, if there is a student that requires help, there's always somebody who can help them. So that is the primary motto that we always try to, help around, whether it be curricular, whether it be co-curricular, whether it be extracurricular, or even outside the class. We always encourage students to stop us in the middle of the lecture if you do not understand something, and then ask it right there. So it's not like, we are trying to, put forward a teacher-centered system. We always prefer a student-centered teaching philosophy, and all of us, we try to help students in as many ways as possible. So that can be, even co-curricular activities where we try to help students find, any activities that they could do either in the community, as Dr. Niemeier mentioned about work that is required. So let's see if we could find a way to do that. So we are more as a guide rather than helping you out and, trying to spoon feed everything to you.
Thank you for joining us. I have another faculty member, Professor Naresh Sharam, Associate Professor for Biochemistry. Quick question. How would you describe a model student? The model student who comes and succeeds at New Anglia?
Well, from what I have seen, a model student at New Anglia University is someone who really takes ownership of their learning, and they are self-motivated, they manage their time well, and they show up prepared not just for exams, but for every class, every discussion, and every opportunity to learn. To succeed here at NAU, students need more than just academic skills. They need discipline, curiosity, cultural awareness, emotional resilience, and a strong sense of ethics and professionalism. And the good news is
Thank you, Dr. Naresh.
Thank you. Thank you so much for having me here.
So we have a few students with us today, actually from New Anglia.
Hi, okay.
So, sure. So I have a question for each of you. So first up will be Matthew Dunn from Jamaica, I'm told. So Matthew, how was your transition to Anguilla? Have you felt supported, finding accommodations, transport, and how long did it take to settle into the island life?
My transition to New Anglia was really good. The moment I got accepted and I paid my tuition, Monisha from the office admin, she helped me find accommodation. And when I got here at the airport, she helped me get transport from the airport to my accommodation. They help us to get set up our bank accounts and to get SIM. The teachers and the professors, they're really nice. They're really helpful. Anything you need, you can go to them. They're kind. Yeah.
Great. So from the start to getting going, everything you need, it sounds like. So thank you, Matthew. Aria. So Aria, do you feel like you're learning and moving forward in your academic medical career at the moment?
Yeah, absolutely. I mean, we're already approaching the midterms now. We've had to go through everything's structured, pretty much the way to follow it. Everything's being updated constantly. Anything that changes, they are quick. Professors are quick to jump on it. They make sure we meet deadlines. They help us meet around it. So there's always a standard to meet, really, and they help you meet that standard. So they help you by giving you updates on constant things changing with the university, constant partnerships being made, any opportunities available, anything in the community. So we see that support and we see that how they want us to succeed. So it's been really nice. So I do feel like, yes, I am. Yeah.
That's great. So stay informed and feel supported. So finally, Mana, what do you do for fun? Or, this will go out to everybody at the end, but specifically, what do you do for fun while on the island outside of all the coursework?
Well, me and my friends, we go to the sandy beach here. And then afterwards, we either go and grab a bite to eat or go over to each other's places and hang out.
That sounds pretty fun. I'm jealous. So just to everyone, so if anyone wants to volunteer an answer, what are you planning to study in medicine after medical school as far as residencies?
So we're stuck in between 2 or 3, but so we're waiting for the clinical aspects to come in, and then that will kind of help us decide more, I assume. So we have some of us are interested in pediatrics. My flatmate is actually, and then you said you were thinking trauma and emergency, and then we've got other ones looking at different. So yeah, we're a mix, but every time we study something or we talk about something, we end up thinking, okay, we might actually do something else instead. So it's still in the talks. There's a lot of interesting things we discover.
So thank you everyone for joining us today. And just want to thank all of our students because they're actually headed into their midterms on Monday. So good luck, everyone. You guys are going to crush it. And a really great meeting all of you today. So for our students heading into the United States, we have a very clear-cut plan for every student that takes you from either pre-medical studies, if you haven't completed some of your prerequisites for admissions, or following your bachelor's degree, all the way through obtaining a residency and becoming a licensed physician. So for our typical students, if you haven't completed a bachelor's degree yet, we require 90 credits and additional science classes depending on where you're coming from. Now, after your pre-med or college time, depending on which route you take, you'll begin your MD basic sciences. That's going to be those 5 terms that Dr. Niemeier talked about, and each term is a little bit different. Ultimately, leading up to our 5th term, where our students are going to prepare for their boards. Now, the boards, no matter if you're UK or US, are going to be your MBME. Now, this is a national board. That's a comprehensive basic science exam. So all the stuff that you learned leading up to that exam, you're going to be tested on. For our students to move on to the next phase, they're going to need a 64% on that exam, and we'll have practice tests and everything our students need to know where they are academically leading up. For our US students heading into US clinical clerkships, you're going to have to take a USMLE, so the United States Medical Licensing Exam. Following the USMLE, we move into our MD program for our clinical sciences. This is what I was talking about previously with our core rotations and electives. So that's going to be 2 years of rotating through hospitals, and you'll have associated tests and experiences along the way in multiple fields of medicine. During your 4th year, potentially, you can then sit for an additional MBME exam and USMLE Part 2. And then finally, we head into our graduation, and we're going to prepare our students for our residencies. And so once we're at residency preparation, we're going to have you fill out multiple applications for your MSPE and other things I'll talk about. That's going to prepare you for placement in the residency that you want, and then you'll take a USMLE exam. Now, Michael, he's going to share with us what a United Kingdom student can expect heading into that track.
Thank you so much, Chris. Yes, indeed. We're talking about exactly the same with the US structure, apart from the fact that the USMLE examination, which is not required as they will practice in the UK, right? So we're reiterating that now. Students will need to score 65% on the comprehensive basic science, such as like in the US as well, the MBME examination, before progressing into clinical sciences. That's the only difference, really. Now, again, before graduation, UK students need to complete the clinical science MBME examination. Now, we guide students to register with the GMC and then with the UK FPO before they sit for PLAB 1 and PLAB 2. Now, after they pass both exams, students can then progress with their foundation year employment application through the UK FPO. That's the structure.
So as you can see, 2 slightly different tracks depending on where we're going to practice, and it's important to remember those differences. But what we see is very similar throughout both tracks, and we have that parallel study while you're on the island of Anguilla. So our students who are heading to the US or the UK will have a shared experience. So moving into our next slide, what we want to cover is how we're preparing our students for these major exams. Now, the USMLE and the PLAB seem intimidating at first, but we put so much effort and time into developing a curriculum and plan for our students that we make it very accessible and very clear study and training so that every student has the tools they need to be successful. So when it comes to preparing for your USMLE, our 5 terms, the curriculum that we've developed, are in line with everything you need to know for the USMLE and PLAB. So everything you're learning from day one is going to be this integrated curriculum that our students will use to build that foundational knowledge that they need for these exams. Now, we also will offer a virtual USMLE program for our United States-bound students that's going to drill that high-yield information, offer clinical vignettes, practice questions, PowerPoints, everything you need to be able to pass your USMLE, along with very guided exams that'll let you know how you're progressing as you get closer to your test date. So our clinical rotations, again, are that time where our students are going to be out in the field working side by side with other student doctors to learn how to practice medicine and to get exposed to all the different areas within the field of medicine. To speak with us today, I'd like to introduce Professor Hasan Tahir. Hi, hello, Professor. Very nice to meet you today. So just a quick question for you. What do students do during clinical rotations, including the current teaching methods, assessment methods, weekly timetables, and blocks that they'll experience during rotations?
Fair enough. Good question. So focusing on what sort of teaching that you actually will be getting. There's an array of teaching, and depending on which hospitals that you go to, but in principles, you're going to get things like bedside teaching, and that's the key. Absorbing a lot from ward rounds. So I'll have students coming around on my ward rounds and sort of learning from those ward rounds, and they're usually daily senior clinician ward rounds, say consultant ward rounds. You tend to have things like problem-based learning, depending on which trust that you're on. You may have things like team-based learning, case-based discussional learning as well. There are didactic lectures as well that is part of the teaching. A lot of our hospitals that we've linked up with do what we call simulation training, and it's great. It's like they're using dummies, if that's the right word to use, and they'll have scenarios and cases associated with them. So all really great stuff that actually happens. Just to give you a bit of a feel for what is a general weekly timetable, but the other key thing is a student is usually linked up with a junior doctor. That's the best part of learning, because not only do you get involved in day-to-day stuff, like how do you fill in a drug chart, how do you put in a line, how do you put in a catheter, you're seeing how do you go to a radiologist and request forms. You get to do all of that stuff, what you would be doing day to day. But what you'd also get to do is go and see a patient and then review the patient and then come back and present it to the junior doctors. So you're exposed all the time to patients and what I call pathology on the wards. So it's what you make of it. The more you stay on the wards, the more you will gain out of it. The key thing though with our program is you have to be doing 40 hours a week. But then there is also assessments, by the way. So you will be having things like what we call formative and summative assessments as well. So summative assessments, depending on which hospital that you're linked to, you may have OSCE examinations, which are seeing patients and then presenting those patients, or you may actually have some written form of assessments as well. We've got a huge footprint now. We're building up our footprint with different organ trusts in the country, both in the United States and in the United Kingdom.
Thank you so much for your time today.
Thank you, Chris. Take care.
Let's talk about our partnerships and affiliated hospitals. So out of the United States, the United Kingdom, we have a growing network of affiliated hospitals. So to join us today to speak about our clinical rotations and core rotations is going to be our next speaker, Dr. Sharma from Queen's Elizabeth King's Lynn Medical Hospital. So Dr. Sharma, are you with us today?
Yes, I am.
So to jump into some questions, for your hospital specifically, what kind of experience can a New Anglia University student expect as they're rotating through Queen Elizabeth Hospital?
Okay, so we work in partnership with New Anglia Universities. So I just to introduce myself, I'm an FY3. So I am currently working as a teaching and simulation fellow. So I have been involved in sort of teaching and the experience of the New Anglia students, of which we've had a fair few. So essentially, what we do is we work with the university to appreciate sort of what they want content-wise. So, for example, this year we had students on a 12-week rotation in internal medicine where they went through sort of gastro, respiratory medicine, and such. And then we then had them on surgical placements where they went through urology, orthopedics, and general surgery. What we also do is alongside that, because a lot of the time it's the first sort of time that the students have stepped into the clinical environment. So we make sure that we support them. So there is various clerkship topics that we help organize. We also make sure that we pair them with FY1s specifically who we know, are going to be supportive and help. So they have like a port of call essentially for every single, for any questions that they may have. And to help them do skills and such. We also do small group teaching sessions as well as a simulation sessions as well, which always gets rave reviews and has been very well received in the past.
So thank you so much for joining us. From our newest clinical rotation in the United States, the Miami Rescue Mission is a new clinical rotation that New Anglia has brought on just recently this past month, located in the heart of Miami. Melanie Gutierrez is here. Yes. So Melanie, hi, nice to speak with you.
Hi, nice to see you.
Melanie, can you tell us about how the rescue mission was started and what makes it unique as a clinical rotation site for everything you do?
Yes, of course. So we basically were born out of a homeless shelter that is across the street from us, which houses from 400 to 600 people. And it's been around since 1926, I believe. And then in 2009, we opened the Miami Rescue Mission Clinic, which basically works almost as an HMO to the shelter. And we work with all of the homeless population in the area. And so basically we serve the 3 centers that we now have in the Miami and Broward area to help all the homeless population. And so through there, we have also we work with different preceptors and hospitals and centers in the community to offer rotations to students in all different disciplines. And we are basically like the hub. So what we do primarily in our center is family medicine. We have a simulation lab, so we do all kind of simulation stuff. But all of our other partners are out in the community, and we partner with different preceptors in OB/GYN, in pediatrics, in internal medicine, and surgery, psychiatry, and all different type of electives. So that's kind of like our hub, and that's how we, work with the different students in the area. It's a new, it's a niche that most medical students don't get to work with this type of population, and they get to practice their skills because you'll hear from one of my previous students now, but basically everything you get to practice in school, these patients have been, haven't been in healthcare, haven't seen a provider, so they're super appreciative, and you get to practice in real life all the things you've learned, whereas in private practice that's not always the case. So again, aside from the fact that we obviously have clinical rotations, we do offer they can come and shadow. We have a simulation so they can come and practice their skills, their physical exam, their HMPs, all of that, and as well get their feet wet with the clinic and the family medicine portion of it.
Absolutely. And I think the great thing for our students and prospective students to know is that Miami is a direct flight right to the island of Anguilla and vice versa. So we're very excited to form this new partnership and very excited about the future. And thank you, Melanie, for joining us. And she mentioned that she has a previous student who rotated through the clinic, Alexis Foster. So Alexis, are you here with us?
Hi there.
Hi, Alexis. Nice to officially meet you. So, Alexis, could you tell us a little bit about your experience at the Miami Rescue Mission Clinic?
Yeah, sure. So I'm a 4th-year med student at Ross University School of Medicine. I've done pretty much my entire 4th year of electives through the clinic. And so it's very nice because you get a different experience, as Melanie has previously mentioned. So we do deal with a lot of like the underserved or the underrepresented population. And so it's really nice in the fact that you get to better your skills as a physician, but you also get to, be humble, and you get to basically help others in ways that, you don't usually see like in the traditional medical setting. One of my favorite parts about it is that you get to actually go out and be a part of the community. So the clinic actually does a lot of different services. The most recent one that I did was the Good Friday service. And so you were out there actually doing blood pressures for patients. You were actually taking glucose readings for patients, telling them to come into the clinic to get help that they need, getting meds that they aren't able to afford, but that we are able to provide for them.
Absolutely. Wow. Amazing work. Thank you so much, Alexis. It sounds like a great opportunity. And moving into our next slides. Within our support services, we've developed support services for our students throughout the entire time. So from the MBA and the USMLE preparation, we talked about how our curriculum is designed to support passing these exams, how we have our comprehensive test prep for these exams throughout your entire medical education. For our clinical rotations, we've talked about what it's like in the clinics and the clinics that we offer. But it's important to remember that we have a staff that's going to help our students pick the right rotations, pick the right electives that's going to set them up for success when it comes to the match. Now, we offer one-on-one meetings with students during their MD5 semester. And so once you're done clinics and you've made your elective decisions and you're prepared, we really help students make sure that they are ready for the match. We make sure that the pathway is very clear and we have all the support services ready for our students. So moving into our next slide, our admissions requirements. We have specific requirements that we ask for our students. First, our admissions dates. So when we accept students, there's going to be every, it's like a trimester. So September, January, and May start dates. Now, for our MD program, depending on if you are a high school, for the US, depending on if you're a high school student, we require a high school diploma and then completion of our pre-medical coursework along with 90 credits of university level classes. And then for our UK students, we require A levels for the equivalent of high school A level, the BTEC IB access. Now, our pre-med program that we mentioned for both UK and US, so the diploma and then the access, that's going to be 1 year online. So if you don't have a bachelor's degree yet, if you're a high school student or you're thinking about a career in medicine, we have a plan for you so that you can complete your pre-medical classes with our school online and then directly apply and potentially matriculate into our MD program. Now, for our MD program, we require a bachelor's degree, 90 credits, so 90 credits plus our pre-med program, or a bachelor's degree that meets our pre-medical science coursework. Completing our MD program will be a master's degree of Doctor of Medicine. It's a 4-year program. And again, we have 3 different enrollment periods. So if you're interested in joining or have a question about our program, remember our QR code on the left-hand side for any general questions that our admissions and team will get back to you on, or send us an inquiry as far as your application, and we can give advice and take a look at all of your transcripts and figure out what plan works best for you. When it comes to medical school, an important question that we get asked is funding funding your education. For our US students specifically, this is for our US students, we just are announcing our health professions loan. So for US students, the requirement would be residency in the US. This is a private loan for pre-medical or medical students designed to cover the cost of tuition for your medical degree. So it offers up to $95,000 annually towards tuition, living expenses, travel expenses, board fees, and all of that is built into this loan. So it's designed for health professionals. This is going to be available with fixed and variable interest rates, and it's designed to cover all costs. It may require a cosigner depending on the student application. And there's multiple repayment terms, whether it's 5 years, 10 years, 15, and also deferment plans while you're in medical school and in residency. Undergraduate. So for our US students or students interested, not just US students, but students interested in obtaining an undergraduate or master's degree in a US school, we just are announcing a partnership with Franklin University. Franklin University, based in Ohio, is a university that offers in-person and online classes and full US bachelor's degree, undergraduate and masters and actually PhDs. For New Anglia students, we're excited to announce that we have a specific program for students who either are just starting their bachelor's degree or have some college credits or maybe most and would like to complete their bachelor's degree. They can apply and start their undergraduate work with Franklin while completing our basic science courses and then directly matriculate into New Anglia at that 90 credit mark. And that usually takes about a year. So we're very excited for this opportunity. And it's great for students who'd like to complete a medical degree and also gain a U.S. Undergraduate degree and master's degree potentially. Now moving into the island of Anguilla. So the great news about studying at New Anglia University is the fact that you're studying your medical degree at the beach. So a lot of our students joined us today and talked about how they'll go from classes and then hang out with friends, go to the beach, go into town and have fun. That is the great part of the island of Anguilla. So about the island itself is in the heart of the Caribbean. It has beautiful weather all year round, sunny, warm, breezy, tropical environment. The language is English. So no matter where you're coming from, US, UK, you speak the dominant language. The currency is either going to be the Eastern Caribbean dollar or the US dollar is widely accepted. On the island itself, we have modern healthcare, shopping malls, 7 commercial banks, all available to students. And the big news right now is that for international flights, so we mentioned earlier that there's a direct flight from Anguilla to Miami. Important to know, now there's a direct flight either from Boston or from Baltimore, United States, directly to the island of Anguilla. So it's great to know that we have these direct flights. When it comes to living accommodations on the island, there's a few different options. So we have private accommodations, which are going to be offered to including apartments, villas, condos. There's a center city called the Valley on the island itself, where there's universities, shopping, local amenities, everything you might need. Something important to note is that we have new student halls that are becoming available. This is going to be an opportunity for our university students where they can live together in a community style hall. So next we have a video from our head of student services, Monisar.
Hello and a very warm welcome to New Anglia University. My name is Monisha and I am part of the admin office here. We are excited that you're considering joining our community, and I'm here to share important information that can help prepare you for your relocation here to our beautiful island of Anguilla. We know that moving to a new place, especially an island, can feel overwhelming at first, but please rest assured that we are here to guide and support you every step of the way. Anguilla is one of the Caribbean's most safest and most peaceful island, and it offers a perfect blend of natural beauty and modern convenience for our students. First, let's talk about getting here. Anguilla is connected by air and sea. You can fly directly from Miami with American Airlines, or you can take a short ferry ride from nearby St. Martin, which has even more international connections. Once you arrive, our friendly team is here to help you settle in. One of the most important aspects of your move is finding accommodation that suits your lifestyle and budget. At New Anglia University, we assist all our students in securing housing, and we work closely with trusted property owners across the island. You have several options to choose from, whether it's a single house if you want more privacy and space, a private room in a shared home, shared accommodation with 1 roommate, or a shared accommodation with 2 roommates. These choices give you flexibility depending on what's important to you, whether it's peace and quiet, budget friendliness, or more social living arrangement. In general, you can expect accommodation costs to range between $300 to $1,500 US per month, depending on the type of housing and its location on the island. We are here to match with your accommodation that best fits your needs. Whether you want to be close to campus, near the beach, or in a more local neighborhood, our team will help you find the right place. In the meantime, if you need temporary housing while you search for long-term accommodations, we can assist with short stays at local hotels, guest houses, or vacation rentals. There's a range of options from budget-friendly inns to luxury resorts depending on your preferences. Now, a quick note about getting around. Anguilla doesn't provide public transportation, so most students either choose to rent a car or buy a car, or even a scooter. If you plan to drive, remember that we drive on the left side of the road here. You'll need either your home country's license or your international driver's permit. And don't worry, we can provide guidance on rental services and local driving rules as well. When it comes to everyday needs, like opening a banking account, set up a phone plan, or getting internet at your home, we'll help you guide you through the process. Local banks such as National Commercial Bank of Anguilla offer student-friendly accounts providers like Flow and Digicel will keep you connected. Finally, we understand that moving abroad and choosing the right university is a big step, and it's completely normal to have questions. That's why we want to personally invite you to visit us here in Anguilla. Whether you're still exploring your options already or considering joining us, we encourage you to come experience the island and the university firsthand. During your visit, you'll have the opportunity to take a private guided tour of our campus, meet current students, and speak directly with faculty members. You'll get a real sense of what student life is like here. From the classroom experience to the unique lifestyle that Anguilla offers, our team will walk you through the facilities, answer your questions, and help you envision what it's like to study and live here. We believe that seeing it for yourself, the beauty of the island, the supportive academic environment, and the welcoming student community is the best way to decide if New Anglia University is right for you. So please consider this your personal invitation. We love to show you around and help you take the next step towards your future. Thank you, and we're looking forward to seeing you soon. Have a good day.
So a big thanks to Ms. Lakes for sending us that video. So while you're studying and in Anguilla, it's important to remember that you can work. So depending on where you're coming from, to help with expenses and just to have, extra things on your resume, you have work options. So if you're in Anguilla or planning to move there, you can have plenty of part-time jobs and different opportunities available to our students. If you're interested, there's links to public service vacancies, and also on the Facebook for the Labor Department, there's jobs that are posted all the time. You can apply for a student work permit, and our school can assist you in that process. Moving on to our next slide, we have a member of the Anguilla, representative of the Anguilla government today, Mr. Brett Romney.
Good afternoon.
Thank you so much for joining us today.
Thank you for having me.
Absolutely. So a few questions for you, sir. How does the island of Anguilla support higher education for international students?
We ensure that we have the appropriate regulatory framework to ensure high quality and to ensure consistency in the delivery of education services by all higher education institutions. We also ensure that these institutions have creative and relevant and fit for purpose student support services that ensures that when students visit our islands, they are well taken care of. The last thing we would want in Anguilla is a scenario where students feel unwelcome, unsupportive, or not fully equipped to engage in studies that are critical to their future development. The next thing we do is we ensure that visa requirements and so forth are handled in a professional and swift manner. We have a student permit process for all non-Anguillan students that are studying in Anguilla. Once students complete the application and submit the supporting documentation, there are literally no bureaucratic delays whatsoever. Student permits can be issued in a matter of days rather than weeks or months. And we also ensure that Anguilla as a society, and we don't have to do this because for those persons who are familiar with Anguilla, service is our key industry. We are modernizing systems across the island. Most of our government systems now are digitized. Most government services are accessible online, or when you engage government offices, you're dealing through an automated process. That cuts down the bureaucracy and ensures that key government services are delivered in a timely manner. And I can go on, but what I want your students to understand is that Anguilla, as a service industry, as a service-based country, we're here to welcome you, to take care of you, to ensure that you have the best experience possible, and we do hope that you would choose Anguilla as a destination to study.
That sounds great. Thank you so much, sir, for joining us today. It was a pleasure meeting you, and the insights on the island life are very important. Next, we have another representative, the Honorable Mr. Perrin. From your background, you play an active role in national incentives, including emergency response, communication, engagement of public health, and really management on those strategic levels. So thank you, sir, for being here today.
Thank you very much for the opportunity. I'm actually traveling at the moment, so it was a bit so logistical. I was running back, but I'm very happy to be up for the invitation.
How does the island's safety attract international students?
I think we've been consistently ranked as one of the safest countries in the region. Yes, we have our challenges every now and like everywhere else. But it's a very, very safe destination. We want to make sure that not just our students, but anybody living in Anguilla feels safe and comfortable, because again, that balance between studying and living and enjoying life has to be met. So we've recently employed, we've got additional police officers on the streets. We've had a lot of support from the UK government and our sister territories around the region, all in making sure that we have a very safe and strong police force. But again, it's not only, but it's about peace of mind. We want people who are in Anguilla, whether you're a tourist or student or somebody who lives here, to just be able to go out and enjoy your life, because we've always been a very warm and welcoming people, stable democracy. We just had a peaceful transition of power at the last election back in February. We're built on very strong family and a very responsive public service. So if anything happens, you can get a response pretty quickly. We just recently set up a joint emergency services control room that takes care of our 911, deals with fire, police, disaster, anything. And we've just recently won an award for innovation for doing that. So we do take public health and public safety very, very seriously. Go out of our way to make sure that anybody who's in Anguilla feels safe and comfortable and about to go about their business in a very safe and respectful way.
Thank you very much for joining us.
Thank you very much, Chris. It's been a wonderful opportunity, and we're just very happy, very thrilled to have New Anglia in Anguilla.
Thank you.
All right, bye-bye.
All right, thank you, Chris, and goodbye.
Thank you. For anyone, we had a lot of great questions that we covered, and we see just how safe and how welcoming the island really is for our students. And it's just going to get better over time with all the innovation that they're bringing to the table, and just, the support from around the world and from our team. So if you have any specific questions, again, you can reach us at admissions@newanglia.com. If you're a U.S. prospective student, you see our number for UK and for our general campus. Feel free to reach out at any point, and you'll be connected with an admissions officer and a member of our team to figure out where you're coming from and how we can help you achieve your goals of becoming a future physician. So thank you all again, and please reach out if you have any questions.
Thank you everyone for joining as well. We've really enjoyed presenting New Anglia University. Thank you for joining.